Good day, everyone. I'm Hannah May Ruiz, your student nurse from Nueva Ecija University of Science and Technology, and I am here to demonstrate the cranial nerves assessment. For the assessment, let's check for the doctor's order, client's level of consciousness and level of knowledge and understanding, availability and functionality of the needed materials, assess mental status or ability of the client to participate. Next is the planning. If possible, determine whether a screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. Next one is prepare the equipments. First is the percussion hammer, wisp of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, sugar, salt, lemon juice, quinine, flavors percussion, tuning fork, tongue depressor, paper clip, pen light, and clean gloves.
For the implementation, first introduce yourself and verify the client's identity using agency protocol. Explain to the client what you're going to do, why it is necessary, and how the client can cooperate.
Be able to identify the problem using physical assessment on your cranial nerves. So, I need your cooperation, ma'am, to finish this procedure quickly and smoothly. So, can I have that, ma'am? Thank you. What's your name, ma'am? Can I see your name tag, please? Okay, ma'am. Can we proceed to the procedure na po?
Second one, perform hand hygiene and observe other appropriate infection control procedure, then provide privacy for the client.
Inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with smell, vision, taste, touch, or hearing.
For the cranial nerves, cranial nerve number 1, olfactory, ask the client to close their eyes and identify different mild aromas such as coffee and vanilla. For the second cranial nerve, optic, ask the client to read Snellen's chart and check visual field by confrontation. For the cranial nerve number 3, checking the perla and the pupil reaction. For the cranial nerve number 4 and 6, trochlear, assess 6 ocular movements. For the cranial nerve number 5, trigeminal, while the clients look upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. To test light sensation, have the client close their eyes and wipe a wisp of cotton over the client's forehead and paranasal sinuses. To test deep sensation, use alternating blunt and sharp ends of a safety pin over the same area. Cranial nerve number 7, facial, ask the client to smile, raise the eyebrows, frown, Puff out cheeks and close eyes tightly. Ask the client to identify various tastes placed on the tip and sides of the tongue, sugar, salt, and identify areas of taste. For the auditory or the cranial nerve number 8, assess the client's ability to hear the spoken words and the vibration of a tuning fork. Cranial nerve number 9, glossopharyngeal. Apply taste on the posterior tongue for identification. Ask the client to move their tongue from side to side and up and down. For the cranial nerve number 10, vagus, assess with CN9, assess the client's pitch for hoarseness. Cranial nerve number 11, accessory. Ask the client to shrug shoulders against resistance from your hands and turn head to side against resistance from your hand. Repeat for the other sides. Cranial nerve number 12, hypoglossal. Ask the client to protrude tongue at midline, then move it from side to side.
Last is the evaluation. Evaluate the patient's response to the procedure, document the procedure and other important data on the client's chart.
And that's it. That is my return demonstration for today. Thank you for watching.